Hi, Dr. Del Grosso from SF Chiropractic. I want to talk to you briefly about something we call frozen shoulder. Frozen shoulder really isn't an injury or an issue, it's more the result of an injury or a problem. Okay, and with frozen shoulder, usually it involves what you've heard and you know, the rotator cuff. Okay, if there's an injury to your rotator cuff, if there's a strain, if there's any type of injury whatsoever, what happens is, it causes some pulling, some tightness, and it hurts. So what do you do when it starts to hurt? You don't use. You kind of guard, you protect, you don't use. And as you do that, what happens is you start to get scar tissue in there, a lot of things start to happen, the muscles tighten up, and you get what's called frozen shoulder. So frozen shoulder really is just a result of disuse or lack of use. And the way to avoid that is if you do have a shoulder injury, if you've done something to your shoulder, you hurt your shoulder, you're starting to feel pain in your shoulder, you need to get in. You need us to let us look at it. You need us to take care of it, evaluate it, give you things to do to keep that range of motion, to restore that motion. Because again, if you don't, you will get frozen shoulder, and shoulder, you get adhesions, a lot of different things happening. You start to lose the mobility in the shoulder, and it will actually get to the point where you can hardly lift it. And it doesn't have to be. If you just manage it properly, if you get in right away before these symptoms start to occur, that'll never happen. All right, so get into the office, shoulder pain, injury to the shoulder, get in, do something, work on it before you start to get the symptoms and the thing we call frozen shoulder. All right, thank you.